and Pacific on CNN.
First case of Ebola diagnosed in the United States.
First Ebola diagnosis here on U.S. soil.
Ebola in the United States. Doctors confirm the first case has been diagnosed in America.
Ebola has been diagnosed here on American soil for the first time.
There was some concern about Ebola, exposures to Ebola. Probably should have been tested earlier.
The day has come, the first case of Ebola on U.S. soil. What, if anything, can be done? This has been being discussed now for months. Will Ebola make it to the U.S.? Well, now it has. Almost 20 people now potentially exposed in the Texas area. This guy, Thomas Eric Duncan, walking around for over a week before he's finally diagnosed with Ebola. This amid reports he actually told staff at the hospital he had been in Liberia, and somehow that was never communicated. They let him go, gave him an antibiotic. Now, those 18 people include 5 school children that are being quarantined to determine whether they have Ebola symptoms. School children, all of them, to my understanding, in different schools. If they've been infected, who have they infected? Now, Sanjay Gupta, Dr. Gupta, just told us you can't pass this along unless you are showing manifesting symptoms. That's the good part. Straight out to Dr. Amy Edwards, infectious disease specialist, joining me from University Hospital, joining me from Cleveland. Dr. Edwards, thank you for being with us. I've heard that we're desperately working on an antidote, a vaccine to this. What do you know, doctor?
So there is a vaccine under production. Actually, there have been many attempts at making a vaccine for Ebola over the years, and none of them have been successful, but there is one that is actively in trials right now. It wasn't yet ready for human trials, but in light of the current Ebola outbreak, the manufacturer is working to ramp up production faster and is going to start rolling it out. I believe their goal is to roll it out before the end of the year.
Is it, Dr. Amy Edwards, is it a vaccine? Or
it is a vaccine, yes.
Oh, is it a cure?
No, it's not a cure. There are a couple of drugs that are under investigation for potentially helping to treat patients with Ebola. None of those are yet proven to be effective. So this that we're talking about right now is a vaccine to help prevent the spread of Ebola.
Okay, Dr. Edwards, you say there's not a cure, but when you put someone with Ebola in the hospital, how do you get them well? How do you treat them?
So you give them supportive care with Ebola, as with all of the hemorrhagic viruses and any virus that induces vomiting. You worry about the intravascular volume, so the blood volume, and they can lose a lot of fluids in a very short. Okay, I don't know what that means. You worry about the intravascular volume. The blood volume inside the body. You can become very dehydrated when you have Ebola virus. And so one of the mainstays of therapy for a patient with Ebola virus is going to be IV fluids and supportive care to keep their blood pressure up and to keep them hydrated.
Occasional diarrhea, gas and bloating? I trust my gut to Culturelle.
Culturelle, the only probiotic with 100% Lactobacillus GG, the most clinically studied probiotic, to help your digestive system work better.
First, the cookie at check-in. Then, a little weekend to remember. Join us for the celebration package with sparkling wine, breakfast, and a late checkout. Doubletree by Hilton, where the little things mean everything.
The Constant Contact Toolkit makes it easier than ever to connect with customers using all the best marketing tools, like online promotions and email newsletters, so you can help your small business do more business. Try it free at ConstantContact.com.
People with type 2 diabetes come from all walks of life. If you have high blood sugar, ask your doctor about Farxiga. It's a different kind of medicine that works by removing some sugar from your body. Along with diet and exercise, Farxiga helps lower blood sugar in adults with type 2 diabetes. With one pill a day, Farxiga helps lower your A1C. And although it's not a weight loss or blood pressure drug, Farxiga may help you lose weight and may even lower blood pressure when used with certain diabetes medicines. Do not take if allergic to Farxiga.